Hello, welcome to the Heroes for Oral Health podcast, a podcast series based on the different heroes in the oral health care space. Today's podcast is an interview with Alyssa Spilsky, a 2019 DTA Foundation and Patterson Dental Scholarship recipient. Hi, Alyssa. Why don't you start off by telling us a little bit about yourself?
So my name is Alyssa Spilsky. I'm a fourth-year dental student at the Iowa College of Dentistry and Dental Clinics in Iowa City. I got into dentistry for numerous reasons, but mainly I wanted to help people, and the healthcare field basically interests me the most. And dentistry, with the skills that you acquire being a dentist, like you can easily transfer them to locations, to outreach, and I'm really into volunteering, so I thought it would be a good fit for me.
You listed in your scholarship application some of the work you've been doing and a little bit about your school. So I wanted to first ask you about
Sure.
the dental public health distinction track, and within that, your experience with the linkage between oral health and overall health.
Yeah, so the Dental Public Health Distinction Tract is something that my school offers for those students who are interested in learning more about dental public health. There's a few requirements that kind of go into it. So as a student, you have to take 4 additional courses on top of the main, dental school curriculum that have various topics, including like the United States healthcare system, intro to nonprofits. There's a service learning trip to Ecotepec, Mexico that I also went on, and various other things. And then you have to participate in volunteer events that are put on by the Dental Public Health Club, and attend some lunch seminars that are also put on by the Dental Public Health Club that happen at school. But I guess as far as the linkage between oral health and overall health, the Dental Public Health Club and the distinction tract itself really give you a better perspective. In dental school we learn, how important it is to keep your body healthy and your teeth healthy, and just like how they're, all related. But overall, I think the main thing that it teaches you is just how important it is to educate your patients, prevention, and like measures they can take, in advance, just so that they don't run into any issues in the future, or, ways they can help prevent future disease in their mouth. Yeah, stuff like that.
And so within that, you also kind of mentioned that you plan to work for a federally qualified health center or community health center. Can you kind of explain a little bit about how that is different than our dental practice, and
Sure.
why you feel yourself drawn to working for these centers instead?
Yeah, so a federally qualified health center, or FQHC, gets its name through, I guess, the government kind of classifies these centers. So they have to have a certain HPSA score, and they have to score accordingly on their, in an area of need, typically more rural areas, in the United States. And through the government process, they can be qualified as an FQHC. And community health center is kind of similar to the same thing, is where, they offer medical, dental, pharmacy, behavioral health, like all in kind of one encompassing practice. Instead of having patients to go to multiple locations, they can kind of just go and be seen, at one location and get all their services that they need. And what really, drew me to working in some of these locations is just the population base that they offer care to. So a lot of these centers, they'll take the state insurance, Medicaid, dental wellness plan, all the same thing, but a lot of private practice dentists unfortunately don't accept that insurance due to the lower reimbursement rates, or just the population base themselves. Sometimes they can be a little bit more unreliable. So a lot of these patients just don't have a lot of places to go besides these FQHCs or community health centers. So I guess it's my goal just to be able to kind of help these patients, get the care that they need. Yeah.
Within your application, you talked about your belief that all should be provided care. And so will you go a bit deeper into that, and really what you see as the potentials for kind of breaking down barriers to care?
Yeah, and it's no question that dental work and dental treatment just costs a lot of money, and unfortunately for a lot of patients, it comes down to, well, should I get groceries? Can I put gas in my car, or am I gonna, get my teeth cleaned? And a lot of times, the oral health and its necessity comes, lower down on the tier of importance for patients. And I really think that, trying to break down these barriers, such as transportation getting to the dental office, offering more variable office hours so patients don't have to, rely on either taking off work, losing that money, and then going to a dental appointment, spending more money, whereas they could, get a full day's hours work in, and then come see you and not have to worry as much. So I think there's just like a few, ways that dentists can be more compensating and, getting the care that these patients need, accepting the state insurance plan, whether, it doesn't have to be your whole practice, but, a few patients, not a few, but, a decent amount, can go a long way so that, not their only point of care can be at a community health center.
Right. Well, I definitely think it's awesome, and keep doing all the wonderful, amazing work that you're doing. I did have
Thanks.
one more question about, you did meet with Tim Rogan at Patterson Dental. They had their sales meeting, and I believe they invited you to that.
Yes,
and
they did.
they were the named donor for your scholarship. And I just wanted to ask you about meeting in person with, a scholarship donor, and
Yeah.
if kind of what you felt about that.
Sure. No, it was a truly awesome experience. When Tim gave me the call, like, hey, like, you've been accepted, and we're sponsoring your scholarship, it was like a really nice personal touch to be able to hear from the person, and the company that represented everything, that, they were the ones that, chose me and, everything. And then being welcomed so greatly by them to their annual sales meeting in, Las Vegas, Nevada. Like, it was such an awesome experience. And at that event, I got to learn a lot more about Patterson Dental itself and like their philanthropy interests and like their interest in giving back to the community that they work in. So that was a really cool thing to, get to know about them, and just how much that like also resonated with me, because we both enjoy community service and everything. So it was a really awesome experience. Definitely worth it.
All right. Well, thank you again. And is there anything that you would like to say, or that maybe I might have missed?
Not anything I can think of. I think your foundation is awesome, and I'm truly grateful for, what you guys have, done for me, and partaking in, contributing to my education as a dental student. It's been really awesome.